of a professional certification. We have two speakers with us today. First, we will hear from Mara Udelman, Chair of the Certification Commission for Healthcare Interpreters. She is also the acting managing attorney of the National Health Law Program's Washington, D.C. office. At NHELP, Mara directs the National Language Access Advocacy Project, funded by the California Endowment to increase awareness of language access issues at the federal level. Next, we'll hear from Dr. Cheryl Wild from Wild & Associates. Dr. Wild, who has worked in the certification and test publishing industry for 35 years, is helping CCHI develop a valid and credible certification program. She serves as an independent assessor of our work and advises us on quality issues. She has written numerous articles on testing and process improvement. She's co-editor of the book Improving Testing, as well as co-editor of the new Institute for Credentialing Excellence Handbook, which was released last year. After all presentations are finished, we'll open up the discussion for Q&A. So now I'd like to turn it over to Mara.
Thank you so much, Anna, and thank all of you for joining us today. This is the inaugural webinar in the Certification Commission for Healthcare Interpreters webinar series, so we're thrilled that you all took time out of your day to join us. We're going to be going through some slides and then, as Anna said, be available to answer some of your questions, and we'll also be answering some of the questions that people have submitted in advance when you went through the registration process. The goal of today's webinar is to give you an overview of who we are and how we've been working to develop this certification program that will benefit all healthcare interpreters over the coming years. CCHI is the answer to the 20 years of conversations that have been happening in the field to establish one set of standards for healthcare interpreters and to determine the competency of interpreters through a professional certification program. CCHI was launched 1 year ago, and it was created by interpreters, for interpreters, and the public good. To date, we've involved over 3,000 individuals in the development of our certification program, and we're really just thrilled to have everyone's involvement and feedback as we develop this, because the benefits of certification are important for the field, for interpreters, for healthcare providers and patients, and it's critical that all participate in the development of this process to ensure that the result is the best possible certification program to meet the broader needs of the healthcare arena. We've brought together in our work the necessary stakeholders to develop our certification program, and over the next few slides I'll share with you who we are, our commissioners, our advisors, and our supporters. First, I'd like to introduce you to CCHI's commissioners. There are 13 of us, more than half of whom are currently practicing interpreters. We represent a wide range of stakeholders in the interpreting and healthcare arena. A number of us work for nonprofit organizations and community-based organizations as interpreters, or training interpreters, or coordinating interpreter services. Some of us work for language companies who provide interpreter services, and some of us work for healthcare providers. We really believe that this is a stellar group of individuals, many of whose names are probably recognizable to you, and their full bios are available on CCHI's website. We really do encourage you to get to know us and to seek us out by sending us emails, meeting with us at conferences, and really just staying in touch with all of us so that we can represent the interests that you'd like to see in certification. In addition to our commissioners, we have assembled a number of stakeholder advisors to work with us in this process. And the reason we've assembled these advisors is really twofold. The first is that while certification ultimately will be taken by individual interpreters, we feel that it's important for healthcare providers and policymakers working in health to understand our development process and to make sure that certification represents their needs and interests as well. So, for example, we're working with folks, and this really is an alphabet soup of organizations, but folks from the American Medical Association, the American Hospital Association, the Federal Office of Minority Health, the National Committee for Quality Assurance, which is the primary organization that accredits health plans, and many other organizations all listed here. Again, all of the bios for these individuals are on CCHI's website, and we encourage you to take a look at them. In addition to stakeholders from the healthcare provider arena, we've also invited folks from the policy and the certification world to work with us. We feel strongly that we should be following all industry best practices in certification, and so we're building on the experience that others have had in developing certification programs in similar fields as we move forward with the development of CCHI's program. So for example, we've invited folks from the National Center for State Courts, the Registry of Interpreters for the Deaf to participate with us, and also other advisors who work in certification in some of the allied health fields. So again, we really think that this rich and diverse group of individuals has been an essential aspect of really helping CCHI ensure that the development of our program will really meet the needs of interpreters as well as the broader healthcare arena. We also are thrilled to have the support of a number of organizations who have officially told us that they support the work of CCHI. These these organizations are also listed on CCHI's website, and so you can get more information and direct links to their websites as well from CCHI's website. And again, these folks, while they don't, these folks have indicated support for CCHI's process, and we ultimately believe that working with them again will just include a broader, diverse array of input into the development of certification that is critical to make our certification valid, credible, and available nationally. So let me take you through a little bit of our development process, and then I'm going to turn it over to Cheryl to talk more specifically about how one does develop a certification process. CCHI's commitment is to develop a national, valid, credible, and vendor-neutral certification program. We use those four terms in everything that we talk about because we really believe that this sums up the essential nature of our work. So let me just briefly go through each of these in turn. When we say national, CCHI means that our certification program will be available across the country. We really believe that it will help interpreters who are moving from state to state or even from facility to facility in the healthcare arena because they will have a portable credential that is not tied to one employer or agency. The second piece is valid, and this again is the most important concept for CCHI. We are incredibly committed to making sure that when we are developing our certification test, that it is a valid test that assesses the knowledge, skills, and abilities required to be a healthcare interpreter today and test the appropriate tasks that healthcare interpreters are doing on the job. The third key phrase for us is credible. Again, this goes hand in hand with valid, but it's important to us that the certification program is created by interpreters, for interpreters, and the public good. And that's where all of you come into play. And that's why we really feel that it is essential to involve as many people as possible in the development of our process. So again, we've had over 3,000 people to date participate with us and give us input and feedback, and that number just keeps on growing. And so we really do encourage you to work with us, volunteer with us, stay in touch, provide us your comments and your feedback. The fourth term that we use is vendor neutral. And what does that mean? For CCHI, we believe that it is very important that a certification program be operated by an independent organization that is not tied to any existing training, assessment, or testing program. CCHI was incorporated as a nonprofit organization, and all of the work that we do is owned by and remains the ownership of CCHI. CCHI is developing the test, will retain ownership of its test and its certification programs, will be responsible for updating that test, and no individual or organization that works with CCHI will receive any financial or other stake in the program's outcome and financial outcome. So at this point, I'm going to briefly just go over the benefits of certification and then turn it over to Cheryl. There are a number of reasons why we believe that certification can be useful. First of all, certification can help healthcare providers fulfill standards and elements of performance that are critical in accreditation settings. Many of you may be familiar with some new accreditation standards that the Joint Commission came out with recently for hospitals. And one of those standards addresses the competency of staff who are performing various tasks in the hospital. The Joint Commission standards do not require certification of healthcare interpreters, but rather, since competency is required by the Joint Commission, if a hospital chose to have its interpreter certified, this would help the hospital demonstrate to the Joint Commission that it is meeting the standards the Joint Commission has put out. Secondly, certification can help facilitate the management of interpreter services. The goal of certification is to produce a common set of standards to assess the competency of interpreters. And this should make it easier for managers of interpreter services to be able to look to a credential or a certification rather than having to independently assess and determine the competency of interpreters. Third, we also believe certification will lead to a consistency of practices and procedures across the healthcare field. And finally, it serves the needs of individual interpreters. It really can be a benchmark for interpreters to help document their competency, their commitment to the profession, and their willingness to undergo rigorous assessment of their competency. At this point, I'm going to turn it over to Cheryl to talk actually about some of the national standards for the development of certification programs that CCHI is following. And then after she's done, I'll come back and tell you a little bit about the steps we've undertaken to date. So Cheryl?
Thank you, Mara. Mara talked about valid and credible certification. And achieving accreditation based on standards for certification is one way that CCHI can show you, the healthcare interpreters, and your employers, that CCHI's certification program is valid and credible. Accreditation is something that is well known in the healthcare arena because the public can look for accredited hospitals or programs in order to know or validate the quality of the organization. Similarly, in certification, there are national standards for developing certification programs, and certification programs may become accredited. CCHI is developing their certification program to meet the standards for certification, and I'm going to talk about what some of the requirements are in order to meet these standards. I hope that this presentation will help you understand the value of the CCHI certification and be able to explain that value to your colleagues by learning more about how the certification is developed. Okay. The National Commission for Certifying Agencies is the oldest accreditation body focused on the certification community in the United States. Their mission is to help ensure the health, welfare, and safety of the public through the accreditation of certification programs that assess professional competence. In June 2010, 110 different organizations had one or more certifications that were accredited to the NCCA Standards. In all, there were 240 accredited certification programs. This is a very small percentage of the over 3,000 certification organizations in the United States. So participating in a certification program that's accredited really is a standard of excellence for a certification program. Organizations in the healthcare arena include, organizations in the healthcare arena who have accredited certification programs include the American Association of Critical Care Nurses Certification Corporation, the American Board of Multiple Specialties in Podiatry, the American College of Sports Medicine, the American Nurses Credentialing Center Commission on Certification, and the National Board for Respiratory Care. So NCCA is a well-recognized accreditor in the healthcare community. Why are NCCA standards important to the healthcare interpreter? Well, knowing that CCHI is using these standards as the process for developing their certification provides assurance that this is going to be both a valid and credible certification. And secondly, NCCA accreditation is highly recognized in the healthcare community. A certification program that's accredited by NCCA is more highly valued by employers than one that it's not, and this will increase the value of the certification to you. Finally, NCCA accreditation will provide a higher level of confidence to an interpreter that the certification is valid and potentially valuable to your career as a healthcare interpreter. Next, I want to talk about what are the requirements for accreditation. I know you're on mute now, so you can't ask me any questions, but you may be asking yourself why you need to know what the requirements are for accreditation. It's CCHI that needs to know this. Well, what you do need is to understand what went into the development of the CCHI certification so that you can understand the value of the certification for which you are applying. Understanding this can help you explain the value of your certification to patients, employers, and medical professionals with whom you work. As you listen, please ask yourself why these requirements are important to you and to your colleagues. The requirements for accreditation fall into 4 areas. First is purpose, governance, and resources. These really are standards that say is this a legitimate organization that will be around to maintain and support your certification. Standards in this area include that the organization is fiscally sound, that they meet the minimum requirements of having a purpose, mission, bylaws, that they have the human resources available to the work of the organization. This doesn't necessarily mean that they're all employed in the organization, but an organization may hire other groups, like CCHI has hired CASEL to help develop the test. They need to be structured to assure autonomy in decision-making. CCHI is independently incorporated, which gives them autonomy from any membership group or training organization that might want to influence the decision on certification. Another requirement on structure is that a certification organization can't require examinees to complete their training program for certification eligibility. Another requirement on the structure is that there needs to be a governing committee, and this committee needs to include individuals from the certification population, so in this case that would be healthcare interpreters, and the public. The second area of accreditation requirements is responsibilities to stakeholders. And stakeholders are the healthcare interpreters, their employers, the patients who use the healthcare interpreters, and it might include regulatory bodies or accreditation bodies that may require certification. So these standards really are standards that require that stakeholders receive information and that they need in order to make decisions about the certification. So for example, a certification organization is required to have published policies and procedures, and these need to include information about what's on the test and how that was determined, how to apply for certification, eligibility criteria, how to appeal decisions, and information on how confidentiality is maintained. These policies and procedures need to be reviewed and revised periodically. The organization needs to publish a description of the test, how it was developed, and they need to maintain a list of who is certified and be able to verify that an individual is certified. The third area that CCHI would have to meet to become accredited has to do with the assessment instruments. Are they appropriately developed and scored correctly and fairly? So there's a list of activities that need to be done for a certification program that starts with defining the performance domains, tasks, knowledge, and skills used to develop the specifications. This is often called a job task analysis, and CCHI has conducted one, and Mara's going to talk a little bit more about that later. The job task analysis has to be linked directly to what's included in the test. So the job task analysis defines the test specifications. That's the outline of what goes in the test. And there needs to be a report published about this job task analysis. Next, the certification program needs to develop its questions and tests in a way that meets acceptable psychometric practices for developing a test assessment. And this is important to make sure the questions are fair, they have one and only one answer. And once the test questions are developed and the test is set, then they need to develop a cut score in a fair and consistent manner with what's required for the profession. Next comes scoring, interpreting, and reporting scores, and that needs to be done, and a report needs to be made about what was done. Scores need to be reliable, and if you have more than one edition of the test, then the cut scores need to be comparable from form to form. Procedures need to be secure, and there need to be policies and procedures for retaining information. Now, the fourth area of requirements has to do with recertification. And recertification allows you to keep your certification up to date and show that you are keeping up with your field. Now, recertification has to have policies and procedures that are published and periodically reviewed, and the certification program needs to demonstrate that recertification requirements enhance continued competence. You can imagine that if CCHI meets all of these requirements and that a third party has verified that they've met all these requirements, that a healthcare interpreter can be fairly confident in the validity of the certification program. When can CCHI become accredited? We talked a lot about this. They can submit an application, but the requirements are that the test must be administered for 1 year, or that at least 500 candidates have been tested, whichever comes first. Once the certification organization has met this requirement, then NCCA will accept applications only 3 times a year. And once an application has been submitted, it takes 3 to 4 months for an application to be reviewed. So that means that at the earliest it would be 1.5 to 2 years before CCHI can actually receive their accreditation. So what can CCHI do now to put them in a good place to achieve accreditation? Well, here are some of the things they're doing. They're using the standards. We're using the NCCA standards as a blueprint for developing the certification. The vendors that CCHI is using, like CASEL or the communicators, know the certification world and the accreditation standards, and have supported other organizations in achieving accreditation. So they're getting knowledgeable help to develop this test. Thirdly, they're involving healthcare interpreters and other stakeholders in the design of the process. Mara talked a little bit about that in the beginning, and she'll talk more about that in later parts of the presentation. Now, I've talked a lot of sort of theoretically about how you can meet the NCCA standards for certification. On the next slide is the timeline and the steps that CCHI has taken for developing the test. And what I'd like to do is go through specifically some of the steps that are required in the NCCA standards for certification organizations and compare it to what we're doing in the steps on the CCHI certification timeline. The first thing I talked about earlier and under developing a test was conducting a job task analysis. if you look at the bottom row in the pyramid here, you'll see that the 4 steps presented are all steps that were involved in conducting the detailed job analysis. Once the job analysis was conducted, then there were, on the second row up, were steps involved in analyzing the data and creating the outline of the test from the job task analysis. And you'll see that included writing a report of the work. Once the blueprint from the job task analysis was created, then the detailed test specifications and how to develop the test were created. Then the 4th line up would correspond to following established psychometric procedures for development of items. And that's forming a committee, writing items, reviewing them, and then finally selecting them into a test. And we are using CASEL as the vendor to help develop the test because they have a lot of experience in developing valid tests and items. Once the items are developed, they're put into test forms, and right now, where we are, that little blue arrow, is we're getting ready to pilot or try out our test forms. Once the pilot has been concluded, then we can develop cut scores in a manner that will develop comparable and fair cut scores across tests, and we'll be in a position to evaluate the reliability of the tests and go forward with an operational program. CCHI is doing excellent work in developing tests to meet the standards, and I think you could see that as I discussed excuse me, the steps that we've taken. CCHI is also exceeding my expectations in their outreach to stakeholders in the involvement of healthcare interpreters in the development process. And I'll turn the talk over now to Mara, who will talk more about the job task analysis and the involvement of stakeholders.
Great. And Cheryl, again, thank you so much. We really have been very appreciative of Cheryl's work with us in guiding us through this process, which, as you can see, is very technical and detailed, but it's done that way for a reason, so that the ultimate result is a valid and credible test that you as an interpreter, a supervisor, a manager of interpreter, a trainer of interpreter, or a policymaker will be able to rely on and know all the steps that were involved. So what I want to do right now is take you through our job task analysis. And Cheryl mentioned a couple of the steps. What we first did was we brought together a panel of subject matter experts who could represent the depth and breadth of the interpreting profession. And these individuals were chosen based on a variety of factors so that we had diverse representation based on geography, languages in which people interpret, mode of interpreting, so both face-to-face, over the phone, and video, practice setting, so that we aren't just focusing on the hospital setting, but we have interpreters and participants who work with us who practice in a variety of healthcare settings, and other factors. And what this group of subject matter experts did is to first identify the tasks that a healthcare interpreter does on the job today, and then the requisite knowledge, skills, and abilities it takes to do those tasks. Once those folks assembled this very comprehensive list, we then created a draft survey from that, pilot tested that survey, made refinements, and then launched that survey earlier this year, and that's called the Job Task Analysis Survey. And I think, as Cheryl mentioned, there is a comprehensive report detailing all aspects of this survey that is available on CCHI's website. We had close to 2,500 individuals respond to this survey, representing interpreters who work in over 140 different languages. And this really does represent a broad national participation from interpreters as well as supervisors and trainers who could participate in the JTA survey. And the results from this survey provide the framework for developing certification. And just to give you a little bit more detail, the response rate of close to 2,500 people well exceeded the minimum required for statistically reliable results. Cheryl talks about psychometrics, and that's something all of us at CCHI have become much more familiar with. But you do need to ensure that you have sufficient data that you can develop a test that is appropriate nationally and across all those different factors that I mentioned. The languages people interpret, the mode of interpreting, the practice setting, etc. Further, it's also important that we make sure we have that representation so that we know what the job of interpreting is today. That data tells us what interpreters are doing on the job today, not what we think they should be doing, not what we want them to be doing, but we use that data to create this valid and credible certification program. We also analyze that data by different demographic factors so that we could ensure that certain knowledge, skills, and abilities were the same whether you were a Spanish interpreter or an Arabic interpreter, and whether you were face-to-face or a telephonic interpreter. And so again, all of that analysis is detailed in this report on our website, and we do encourage you to take a look. What that did is the results from that survey led us to create the certification test blueprint. And CCHI's test will actually have two parts. And if you've been looking at our application for the pilot test, you're probably getting pretty familiar with this. Part one of our test is going to test an interpreter's ability to manage healthcare interpreter functions. This test will be in English and 100 multiple choice questions. And it will test subjects such as managing an interpreting encounter, healthcare terminology, preparing for an interpreting encounter, including things like ethics and standards of practice and cultural responsiveness. Again, the job task analysis report will give you more of the details that are involved in some of these categories. Part one of our test will be open to interpreters who interpret in any language. Part two of our test is actually an oral or a performance examination that will test an interpreter's ability to actually perform healthcare interpreting. And this test is currently being developed for Spanish interpreters, and we anticipate next year that we'll be able to hopefully start moving into the development of this test in other languages. But initially it will be available for Spanish interpreters, and it will test the skills of consecutive interpreting, simultaneous interpreting, sight translation, and also translation. This is one of those areas where the data shows us what we might not actually all support in healthcare interpreting, and so I'd like to spend a minute just explaining this. There's certainly a general agreement from folks working in the field that the skills of interpreting and translation are very different. And in fact, my organization recently commissioned a report from the National Council on Interpreting in Healthcare and the American Translators Association that explains the different skills that are needed. However, when we did the job task analysis survey, what we heard from interpreters across the country was that they actually are called on to translate. And so while we may not believe that that is the best practice, it is what interpreters are doing on the job now, and therefore it will be on the test. What does that mean going forward? CCHI is very committed to working to educate healthcare providers and policymakers as to the reasons why interpreters should only be interpreting and not translating. And if the field actually changes and we move away from the majority of interpreters doing translation, then when we do an update to our job task analysis, that could come off the test. The same thing came up in simultaneous interpreting. I think the general consensus for many is that most healthcare interpreters are doing consecutive interpreting. What we again found from the data is that a majority of interpreters are also doing simultaneous interpreting. It may be in more limited circumstances, such as in mental health settings or trauma or in the pediatric settings. But again, this is something that the majority of interpreters are called on to do, and therefore we will be testing both consecutive and simultaneous interpreting. So in terms of our next steps, here's what we've done already in addition to the job task analysis. We have a test development committee at CCHI that is overseeing all aspects of our test development process. And as Cheryl mentioned, we have hired Castle Worldwide as our test development vendor. We've also gone back and again done a national recruitment for subject matter experts to work with us on actually writing items or questions for the test. And so we have, again, pulled together a very diverse group of individuals from across the country and different demographic characteristics who have been diligently working over the last couple of months to actually write the questions that will be on both the Part 1 of the examination and then a second group of subject matter experts to write the items that will be on Part 2. Then we will have additional reviews by additional subject matter experts to come in and make sure that all of those items looked right and are appropriate for the test and meet the categories that are on the blueprint. CASEL Worldwide will also be undertaking a very complex review, including an editorial review, linguistic review, and cultural review of all items to determine their inclusion on the test. Earlier this month, we did launch the application for our pilot test. The applications are open through September 1st or until all slots are filled. We have 200 slots for Spanish interpreters, and we have 300 slots for interpreters of other languages. And what we are offering is certification for Spanish healthcare interpreters and a second credential that is not certification for interpreters of other languages. And I know a couple questions came in advance, so let me explain the differences. In order to certify an individual, a certification test must test all of the knowledge, skills, and abilities that an individual must have that showed up through that job task analysis and that are on our test blueprint. Therefore, for full certification, there needs to be not just a written exam, but also an oral performance exam so that we can test someone actually has the skills and abilities of interpreting. As you can imagine, it's very complex and time-consuming to develop certification examinations in multiple languages. And therefore, we have started with Spanish, which is the greatest need, and we fully anticipate developing Part 2 of our test, the oral performance exam, in other languages as soon as we've launched the test initially next year. However, we also recognize that interpreters in languages other than Spanish did want to have a credential that they could use and document that they knew the skills of preparing for and managing a healthcare encounter. And therefore, we have created the credential of Associate Healthcare Interpreter. And the Associate Healthcare Interpreter will be open to interpreters who work in any language. And it will test everything that we detailed on Part 1 on a couple of slides ago. These individuals will not be certified, again, because we can't do a complete testing of one of these individuals' oral interpreting skills. And we will also make it very clear as we work with interpreters and healthcare providers across the country to understand the differences between a certified healthcare interpreter and an associate healthcare interpreter. And we certainly would love to have your feedback on this going forward. You can apply now. We encourage you to do so. There are some prerequisites to participating in the pilot examination. Interpreters must be 18 years of age or older. They must have a high school diploma or its equivalent. They must have completed 40 hours of training in healthcare interpreting, and there's some more information on our website about what can be included in healthcare interpreter training. And they also must have at least 1 year of experience in healthcare interpreting. Again, there's lots of information on our website about the pilot test, including some frequently asked questions, which we've been providing answers to. So if you go to our home page, on the right-hand side of our home page, right at the top, there's a box that says certification. It can take you directly to the application information or to the frequently asked questions. So as I said before, we really have been just thrilled that we've had over 3,000 folks participate with us in the development of our certification program. But we want all of you to feel welcome into the CCHI community and to participate with us and give us your comments and your feedback. And so there are a number of ways you can do this. You can sign up for our mailing list, and we send out a monthly update that gives you updates on our progress and information about new policies and procedures. You can volunteer to work with us in a variety of roles. You can forward information on to others, and you can send us your comments and your feedback as you're looking at our website and going through the pilot application process. We need your leadership and your commitment to ensure that CCHI's program represents what you want to see in certification and meets the needs of all stakeholders in the healthcare arena. And with that, I'm going to turn it back to Anna to start our question and answer period. And once again, just really thank all of you for taking the time today and participating with us And we really look forward to hearing from you and working with you as we proceed through this process. So Anna?
Well, first, a huge thank you to our presenters. We appreciate your taking the time today. Now we'll begin the question and answers. Some of you have submitted questions in advance before this webinar began, and some have submitted questions during the webinar, and we will get to as many as possible. So if we don't get to your questions, please continue to check our frequently asked questions page relating to the certification examination, and many of your questions will be answered there. The first question Veronica just asked a few minutes ago is, why is the pilot test in Spanish more expensive for Spanish speakers versus other languages?
Well, part of it is that for the pilot test, Spanish interpreters will take both Part 1 and Part 2. So first, it's just a longer testing period. It will take you about 3 hours to complete the examination, as opposed to interpreters who work in other languages. It will be a 2-hour written multiple choice examination. The second factor that comes into play is because this is an oral performance examination, we have to provide certain technology and also certain testing environments. If you've ever gone to a test center for another type of examination, you know they're often set up with multiple computer terminals. For our Spanish interpreters, we need to make sure that you are not close enough to another interpreter to interfere or be interfered with. So we'll actually be providing you with headphones so you can hear the oral prompts, with a microphone to record your answers, and also make sure that there's sufficient space between individual testing candidates so that you will have the optimum testing environment. The third piece is that the oral performance exam actually will be scored or rated by 2 individuals. And we have 2 individuals score that to ensure that there is inter-rater reliability. And again, that's an additional aspect that comes into play with the oral performance exam that involves additional time and coordination and expense. Another question that came in that I just want to emphasize also is those of you who do participate in the pilot and pass the exam, whether it's the written exam for associate healthcare interpreters or it's both parts of the exam for Spanish healthcare interpreters, if you pass the exam in the pilot, you will not have to take another exam from CCHI to get your credential. You will be given your credential when everything is finished by the end of this year with the pilot exam. And so we do offer that, and that's one of the reasons why we're having a pretty large pilot sample, is because we do want to give folks the opportunity to come in and work with us. But we also felt strongly that we didn't want to require folks participating in the pilot test to then have to retest when we launch this program nationally early next year.
Thank you, Mara. Excuse me. The next question, how do I prepare for the certification test?
That's a great question. The first thing we encourage you to do is certainly take a look at this job task analysis report, which is on our website. By looking at the details in that report, you'll get much more information about the types of information and the categories of information that will be included on the test. In addition, we've addressed this question in our frequently asked questions, and we encourage you to explore the links on our website to National Code of Ethics and Standards of Practice. Finally, we're working on a handbook for candidates, which we should have available in early September, and we expect that this will have some additional information as well.
Thank you. Jorge Hernandez would like to know if we have a test site in the Northwest.
Okay, so let me explain again the differences between Spanish interpreters and interpreters who work in other languages. For interpreters who work excuse me, in languages other than Spanish, during the pilot test there will be approximately 450 test centers across the country in which interpreters can take the multiple choice written exam. It will be on the computer, and once you are accepted into the pilot test, you will then get information about scheduling your exam. For Spanish certified interpreters, because of those technology issues that I mentioned earlier, we have 21 sites across the country. And we did recently add a site in Kirkland, Washington, which is just outside of Seattle, in response to requests from folks in that area. So we do have a site in the Northwest, as well as 20 other sites across the country, and all of that information is available in the frequently asked questions as well. We also fully anticipate that after the pilot test, when we launch our program nationally early next year, that the Spanish performance exam will be available across the country and not just in limited sites.
Thank you. Are the certification tests only available on the computer?
Yes, we are doing this all through computer-based testing. It offers the most security at this point, and it's also one of the easiest ways to administer tests for candidates. Since going forward, we anticipate that the Part 1 exam you will be able to schedule on an as-needed basis. And if it's a paper and pencil exam, it's often usually relegated to certain testing windows per year. So we believe that computer-based testing offers our candidates the most opportunities to participate in our program.
Suzanne Dunleavy would like to know how the specific needs of sign language interpreters are addressed in the testing.
Thanks, Suzanne, for asking this question. We've actually specified on our website that sign language interpreters are not eligible to participate in CCHI's pilot program or in our testing program. We have actually been communicating with the Registry of Interpreters for the Deaf about this issue, and CCHI did not want to embark on developing a certification program for sign language interpreters when RID has done so much work in this area already. And it certainly is a long-term goal of RID to work on a specialization for sign language interpreters in healthcare. We've explained this a little bit more in detail on our website, again, in those frequently asked questions, and we do encourage you to stay in touch. Just to provide a little bit more detail, if we were going to have this test available for sign language interpreters, we would have had to include sign language interpreters in all of the development aspects. And because there are certainly differences between sign language interpreters and interpreters who work in foreign languages, particularly, for example, in positioning in terms of where an interpreter stands in an encounter, as well as also cultural issues, those would have had to have been addressed during the testing process. And so at this point, CCHI will not be offering a credential or certification to sign language interpreters. We hope to continue working with Registry of Interpreters for the Deaf on this going forward.
Great. Mark Friedman and several others just asked, how will certified interpreters maintain their credential?
Great. And I think Cheryl spoke a little bit about this, but there often is an expectation in the NCCA Standards about maintaining one's certification. And CCHI will be establishing procedures and policies for that. We expect that there will be some requirements for participating in continuing education going forward in order to maintain your credential and to ensure that you're keeping current with developments in the field.
Great. A question just came in. Will passing the written portion of the exam provide a temporary credential for Spanish interpreters?
If you're a Spanish interpreter who participates in the pilot exam and you're taking both Part 1 and Part 2 at the same time, if you only pass one part, you will only have to retake the part that you did not pass after the pilot exam period when we launch in early 2011. We are not offering an interim or associate healthcare interpreter credential to Spanish interpreters because we do have the oral performance exam available in your language. Thus, the only credential that CCHI is offering to Spanish interpreters is the Spanish Certified Healthcare Interpreter, and you must pass both Part 1 and Part 2 of our exam to be granted that certification.
Thank you. Eduardo Garcia just asked, I keep hearing credential and certification. What is the difference?
That actually is a great question. I'm going to ask Cheryl to address that one after I talk briefly from the CCHI perspective, but in terms of NCCA and other testing. For us, as I mentioned before, we can only grant certification to an individual who we have completely tested the knowledge, skills, and abilities needed to be a healthcare interpreter. So unless we are testing someone's oral interpreting skills, as we are doing in Part 2, we cannot offer that person certification. So we have certification for Spanish healthcare interpreters, and we are offering a credential that is not full certification to interpreters in other languages who can pass Part 1. And we felt this was important because many of us on CCHI work with interpreters who interpret in languages of limited diffusion. And we did not want to leave them out of our process because it's unlikely we'll ever have an oral performance exam in every language that might be needed in the U.S. So by offering the Associate Healthcare Interpreter credential, it does offer interpreters a way to document their ability to provide, to know the skills and abilities needed to manage an interpreting encounter, and then an employer or an agency would have to test that person's ability to actually interpret. But Cheryl, maybe you can also provide a little bit of input from the broader testing world.
In the broader testing world, we try to differentiate between certification, which is a process where you identify a person's knowledge and skills, and then you identify the knowledge and skills necessary to work in a profession, and then you assess whether the person has made those has the knowledge and skill necessary, and then they get a certification. And the certification, it has a limited time associated with it. So you get a certification that says, as of this date for the next 3 years, this certification will be valid. Then there are other types of credentials that are available. And for example, in training, there are often certificates where you get a certificate that says you've taken a training course, or you've taken a course and passed the test for the course, and that certificate doesn't have a time limit on it. And a credential is just something that says you've in this case taken the Part 1 exam and have passed the test to show you've got the knowledge and skill in this one area, but we haven't been able to certify that you have the interpreting skills that would be required to be shown in the Part 2 exam.
Thank you both. Alberto Vasquez just asked, where do you see this going on a national level or being implemented as a mandatory model for health interpreters?
That's also a great question, and thank you for asking that. CCHI does not have any authority, to be perfectly honest, in making this a mandatory requirement. Certification is usually a voluntary process, and we fully support that. Those of us working on the development of CCHI have spent most of our careers working to improve language access. And so we see this as one important piece of the puzzle to really help define the profession of interpreting and provide a uniform set of standards that can assess the competency of interpreters. Whether this becomes mandatory is something that will probably be looked at over time. How this sometimes happens in other fields is that individual employers may begin requiring certification or a credential as a condition of employment or to maintain employment. You also may see some states begin to license interpreters, and sometimes as part of a state licensing process, they may require certification or a credential in order to be eligible for a state license. That is certainly something that CCHI wants to work with policymakers and interpreters and others on a long-term basis. But we are very committed to recognizing that certification is new in this field, and that it's going to take time for individuals and policymakers and healthcare providers to understand certification, to prepare for certification, and to participate in the certification program. So we see this as a multi-year level endeavor, certainly for CCHI. We're in this for the long run, but where this goes nationally depends. And just to give an example, in my work at the National Health Law Program, I do a lot of work on trying to improve reimbursement and payments for language services in Medicaid, and we've tried to do it in Medicare as well. Right now, of all the 14 states that pay for language services in Medicaid, only one, Washington State, has certification as a requirement for reimbursement. The rest have developed, if anything, various levels of competency standards. And so again, this might be something we see developing more, but CCHI is working as part of its process to educate policymakers and healthcare providers about the need to take this slowly to help folks understand this process and get used to the process and participate in it before it becomes mandatory, because we don't want to see interpreters excluded, particularly if we can't offer a full certification for someone, and that's what a state starts talking about.
Thank you. And thank you all for participating in today's webinar. As a reminder, a recording of today's webinar will be available on CCHI's website shortly. If you have any feedback, we would love to hear it, and you can email us at info@healthcareinterpretercertification.org.